All right, sports specialization. This is a very important topic, and hopefully we can get through it today and learn some things about what's okay for kids to do and how soon and how much. So we've talked about bad parts of sports, but we have to remember sports are good. Sports really are good. There's physical benefits. We talked about obesity earlier. You sleep better when you're exhausted. There's strength benefits, there's cardiovascular benefits, bone health benefits. Really, sports are good and should be encouraged. There's psychosocial benefits, self-confidence, friendships, there's purpose to what you do, and then hopefully keep you out of other activities that could get you in trouble. So the definition of sports specialization is focusing on one sport year-round at the expense of other sports. More than 8 months a year is typically the cutoff, and then prior to age 12 is generally considered early sports specialization. So why do kids specialize? As we read these, think in your mind, are these adult reasons or kid reasons? So do the kids care about their college scholarship at age 10? Probably aren't thinking about it. Do they care if they win? Yeah, okay. Improve their skills. Do they care if they're good? Yes. Many do. And certain sports demand it. We'll talk about here in a bit. So competitive gymnastics, really if you're going to get to the certain levels, for better or for worse, that does happen at early ages. Ballet, one could argue that you really have to be a ballet dancer to get to the higher levels. Fencing also, and then competitive cheer and golf. So those are some of the sports that perhaps need a little more practice than others, but you still need a good couple of months off to do it right. And then there's some sports that we know specialization early isn't really helpful. Baseball is one of them. We'll talk a little bit about that later. Football, softball, and soccer have been implicated as sports that the more you play, the more you're going to get hurt. So here's an interesting slide. So this was done by the NCAA looking at what are the odds of getting a scholarship in different sports. And these are just the most recent numbers that came out in April. So for men and women, ice hockey and lacrosse are the most likely to get a scholarship. With 12% of ice hockey men in high school going on to college. And now we look at, let's find football. Football right there, 6.9% will go on to some sort of college. That includes all levels of college, not Division I. Division I, it's around 3%. And out of all of these sports, you can see there's a lot of volleyball kids. Well, with women's volleyball, only 4% of those are going to play in college. How many year-round volleyball clubs do we have? A whole lot. So the fact that if you play more, you're going to get a scholarship probably isn't true. And out of all these that end up playing, only 1% will receive some sort of scholarship money. Why do we care about sports specialization at this point? Because there's a growing body of literature to suggest that early sports specialization could lead to harmful effects on the children, specifically acute and overuse injuries, burnout, and depression. So this is a big deal money-wise as well. You may have seen this article in Time magazine last year about the business of youth sports. It's huge. Here's the athlete, and you have the parents giving him some pressure. You have the coaches giving him pressure. You have the kids putting the pressure on themselves. Often they're highly motivated kids. And then you have the thought of college perhaps giving you pressure as well. And that can lead to an unhealthy situation in some circumstances. So there have been, I think one of the main questions we have about sports specialization is, really, is it bad? And what is the primary data looking at whether it is bad or not? Because one could argue that if you're playing the sport a lot, then you're more adapted physically to be able to protect. Maybe that's protective for injuries. And there really isn't a ton of primary data to look and see. I'll go over a little bit of what's gone on. This is a tough to read slide, but these are three of the classic primary studies looking at pitchers, baseball players in general, and their risk factors for getting injured. One of them is a prospective study of 480 pitchers or baseball players aged 9 to 14 who were followed for 10 years. And the biggest risk factor for those kids was if they pitched more than 100 innings a year, if they played catcher in addition to pitcher. And then some of the other risk factors in these other studies were, again, had to do with volume and then how much per year. And I think one of the things I need to mention here is that in all of these studies, in the bottom study especially, there was a relative risk of 27 times more likely to have shoulder or elbow surgery if you pitched when you were fatigued. So continuing on, after you're tired really puts the arm at risk. So in the past, if you guys have coached your kids or played baseball growing up, every league had their own set of regulations as far as pitch counts and days of rest and things. And since 2014, fortunately, everybody's got kind of on the same page. So Pitch Smart is a joint thing between Major League Baseball, Little League, Pony, Connie Mack, all of those leagues, USA Baseball, those things, have all gotten together, and these are the pitch counts and rest. So not only do they have pitch, numbers of pitches and days of rest according to age, but also just some general guidelines. No year-round pitching, no pitching while you're fatigued, follow the pitch count and rest guidelines, don't pitch on 2 simultaneous teams. These all seem like common sense to us, but when you got baseball fever, it's hard. No curveball until 14, and then the slider at 16. And I think this one's really important. Appropriate strength and conditioning, and then watch yourself at the showcases. They say there's the weekend showcases for different reasons, and they'll show up and anybody's seen The Rookie, right? Where he shows up with he's a 37-year-old kid. He shows up with his kids at the tryout. You've seen that movie, and he he goes up and with no warm-up, pitches 95 miles an hour. It's just not happening in normal life. But that's actually what a lot of times what they're doing, these kids. And then put away the radar gun. You guys seen radar guns at 10-year-old baseball games? Yeah, it happens, unfortunately. So this was an interesting study looking at, okay, the Pitch Smart recommendations, do they have data behind them? And this just came out earlier this year. And the ones that really do have good data were no pitching while fatigued, like we talked about, follow the pitch count and rest guidelines, don't pitch on 2 simultaneous teams, make sure you have appropriate strength and conditioning, and put away the radar gun. Interestingly, those were the ones that had the most data behind them. So just to say a couple quick things. Sports specialization, the way I got involved was through the Pediatric Research and Sports Medicine Society. It's a multidisciplinary society that looks to further our knowledge about young athletes. There are athletic trainers, surgeons, non-surgeons, PhD researchers. We have an anatomist. There's or 2 or 3. There's a bunch of really smart people together to get this going. I happen to be involved with the sports specialization interest group, and our project for the last couple of years was trying to increase the primary data about sports specialization. We picked soccer. There are people in our group from California, Virginia, Wisconsin, Texas, kind of all over the country. So we thought we would look at soccer because soccer really is a year-round sport no matter the climate, interestingly enough. So we did an online survey, and we were able to get 760 kids to fill it out. These were kids, teenagers, who play soccer. Most of them were women. We found a lot of things, but one thing this is our first publication, was about, that'll come out later this year, was about specialization correlating with knee injuries, both acute and overuse type injuries. So we'll just go over a few things about overuse injuries by sport. We'll start with baseball. We've talked about the shoulder and elbow. Especially as the shoulder gets tired, what happens is the humerus translates forward, thereby pinching the supraspinatus muscle together with the superior posterior rim of the glenoid right over here. And that'll cause, that's the most typical common overuse injury for young pitchers. Also elbow issues. You got to go from 0 to really fast back to zero in a very short amount of real estate, and that's a lot of torque on the elbow, both stretching on the inside and then compressing on the outside. Soccer can give acute injuries such as ACL tears and then patellofemoral pain, and we believe most of that has to do with what Joe was talking about as far as the corkscrew type twisting that puts a lot of pressure on the knee. Can we prevent knee injuries, especially in soccer? There's a lot of work that's been done and is good work that shows that yes, that these can be, some of them at least can be prevented. There's programs called sports metrics. The U.S. Club Soccer has a program called 11 Plus with some exercises to do prior to play. Children's Hospital of Philadelphia puts a program called Ready, Set, Prevent. And then really some would say the standard is the Santa Monica ACL Prevention Project through U.S. Soccer. Fortunately, these institutions have been very generous about posting these online, so there are ways to do injury prevention. All right, so now we're getting into swimming. Swimmer's shoulder is a real thing. It can be a career-ending thing for kids. It's basically repetition of bad technique. And like Joe said, if you're out running with bad technique for a couple of miles, it's probably not going to get you. But these kids swimming for miles and miles at a time, the bad technique really will catch up. So we have a saying, if you always do what you've always done, you're always going to get what you've always got. And so it sounds simple, but it's like Joe was saying, if you go and take a few weeks of rest and then you go back to what you were doing before, lo and behold, you'll probably end up back in the office. So sports physical therapy is really a very important thing for athletes, especially if they're hurt. One thing I tell athletes is injuries are good, because if you do it right, you will come back a better athlete than when you left. They're kind of bummed they can't play, but really if they can change their focus into getting better, injuries really can be an opportunity. Water polo, interestingly, this is I don't know if this is something I learned. Water polo players, they get hurt a lot. 25 to 80% of elite water polo players from 16 to 20 to 33 will have a shoulder injury at some point. They can be chronic overuse type things, but also acute dislocations. With the arm being up in an at-risk position in a contact sport, it really does cause problems. You really need good technique, and that's a whole world in and of itself. Just in summary, there are lots of organizations that have put position statements out about this. The AAP, I think, has done a great job, Joel Brenner and the gang. This focuses on early on, play a lot of sports, and then specialize toward later adolescence if it's desired at that point. And that's generally what the American Medical Sports Medicine Society, the AOSSM, and the others have said. So in summary, sports are good. Odds of a scholarship are very small. Specialize by late adolescence, if at all, and then follow the guidelines and stay out of trouble. Thank you.